So so before we begin with the questions, if you could, and let me know if I'm pronouncing your names correctly, Dr. Banik, if you can go ahead and tell everybody a little bit about yourself and what you've been up to the last few years.
Sure. So my full name is Rani Banik, but I go by Dr. Rani for short. And I'm a board certified ophthalmologist and a fellowship trained neuro-ophthalmologist. And I was in academic medicine for quite some time, for many years, until I discovered the power of integrative and functional medicine. And now I use a lot of those principles for my patients to help them support their eye health and their brain health. So I have a big focus on nutrition and lifestyle for vision health in my practice.
Great, thank you. And Dr. Tollefson?
Yeah, Tollefson, but
Tollefson.
that's
Tollefson.
no problem.
Yeah. All right, great.
No problem. Michelle Tollefson, no problem at all. So I'm a board certified OB/GYN by original background and training, though my focus has really been lifestyle medicine for women, which is just the use of evidence-based healthy lifestyle behaviors, including nutrition, physical activity, stress management, sleep, and social connection to prevent, treat, and sometimes reverse chronic disease. So I have been spending time. I'm a professor at Metropolitan State University of Denver, where I created and oversee the first Bachelor of Science in Lifestyle Medicine in the U.S. And so that's been really exciting to be able to work with that future generation of healthcare professionals. I serve on the executive board for a nonprofit organization. I've helped with the American College of Lifestyle Medicine, and then became a cancer survivor and thriver of breast cancer about 4 years ago too. So busy in a lot of different areas.
Great, thank you. And so it sounds like both of you kind of started off with more traditional background and then kind of moved into a more holistic approach. So I'll start off, Dr. Tollefson. I'm sorry, and correct me, I want to get it right.
You're fine.
Um, so how was that received when you made those changes? Were your colleagues like, "Oh, that makes sense," or how do they respond to you going from prescribing medications to probably, first to perhaps looking at a more holistic approach and then prescribing medications second?
Sure. So I grew up in a household that we ate healthy meals. My mom cooked home cooked meals with ingredients from my dad's garden. We exercised. I got enough sleep. I wasn't super stressed. And then I went to medical school and an OB/GYN residency, and my home cooked meals were replaced by drug rep lunches, middle of the night trips to the McDonald's in our hospital basement. But I would try to get the healthier options, but still it was the McDonald's in a hospital basement. And I didn't get a lot of stress. There was a lot of sleep, and I rarely exercised. So my lifestyle just totally changed. And I was really surviving. I wasn't thriving. Like I was just like making it through day after day after day. And so when I finished my OB/GYN training and I got out into private practice, I was like, I need to do something with my own health. I need to get back to where I was at before. I moved home to Colorado, which is a pretty healthy state. And I was like, I need to get myself back on track as far as nutrition and physical activity and stress and sleep. And so I started to dive into the literature because, like most physicians, we're not taught a lot about nutrition or movement or stress or sleep in medical school or residency. And so the more I learned, the more I was like, oh my goodness, there's evidence out there as far as nutrition and PMS symptoms or nutrition and all these different health conditions. And so I was excited to find out that in addition to the conventional medicine that I had been trained, the surgical approaches, the prescription drugs, that there were also all these different lifestyle behaviors that had evidence behind them too. And the more I shared them with my patients and then myself, it was the healthier I got, they got healthier, and it was almost like I found a secret superpower in lifestyle behaviors. So I started to incorporate those more and more, but it's hard with a big busy schedule. So I eventually kind of took that turn toward academia and volunteered at a nonprofit clinic where I was able to do more of that. But it really is challenging. It really is challenging for physicians who want to focus more on lifestyle as medicine in a system that really prioritizes fast visits and prescriptions.
And how did your colleagues perceive that change? Did they embrace it? Did they understand it? Did you enlighten anybody? Was there pushback?
Yes, so I definitely believe that I've enlightened people over the years, and now as a professor, I've been able to enlighten so many people. So I feel really excited about that. I was part of the American College of Lifestyle Medicine when there were only like 150 of us, maybe 15 years or so ago. Now there's over 11,000. So I would say people are definitely awakening that the literature is here, the time is now. At first, I did meet more resistance. I would say maybe like 20 years ago or so, when there would just be certain people who are like, that never works. And I'd be like, I'm going to try, I want to teach them about all these different things. They'd be like, there's not enough time, or it doesn't work, or I've tried that before. And so for me, it was really looking into the literature and then sharing that literature. And then as I embraced more healthy lifestyle habits, I just felt better. And people would say, like, what are you doing differently? You seem like you have more energy. And so I would bring a large bean dip to work, and I would share something that I had with others, and they would try it and say, "Oh, that's good. What's in that?" So I think just like little by little, it built. I was able to build that up, but yeah, it was a challenge. I think anyone kind of leading in this different area, or pushing for a more holistic viewpoint within our conventional medicine has challenges to navigate.
Okay, and how about you? What was your experience like?
Yeah, so similar to Dr. Tollefson, during my early years as a doctor, I had a horrible lifestyle, eating poorly. I was living off of pizza and ice cream and Diet Coke most of the time. I didn't sleep much. I had a lot of stress. And so this went on for actually decades. And I really thought I would be immune to all of those after effects of this horrible lifestyle. I never thought it would really affect me, but it did. It eventually caught up with me. And I had migraine headaches once in a while when I was younger, but when I reached my mid 40s, my migraines got really bad. And basically, I developed a migraine every single day. I developed chronic migraine. And the ironic thing is, as a neuro-ophthalmologist, I treat many patients with migraine. And the way I was taught to treat patients would be to write a prescription, like take this medicine, your headache's going to get better. And so I thought that was the best way to treat my migraine. And so I went to some of the top headache specialists in New York City, which is where I live and work. And all they did was they kept writing me prescription after prescription after prescription, and nothing was working. So this went on for about 3, 4 years, and my migraines weren't better. And I said, you know what? There has to be a better solution. So I started to research on my own, and I realized, wow, there's actually literature out there on the use of supplements for migraine, like magnesium and riboflavin. There's literature out there on the use of diet and lifestyle. Yet none of my doctors had ever mentioned anything like this to me. So I started to do some work and, learn about what I needed to do and make some changes in my own life. And that's when I discovered functional medicine. One of my colleagues said to me, like, why don't you try an elimination diet? Maybe that will help your migraines. And I said, well, what is an elimination diet? I'd never heard of one. And so I looked into it, and then I discovered the Institute for Functional Medicine, and I was completely blown away. I went to one of their week-long conferences, and I said, wow, this information is so powerful. Why was I never taught this in medical school? I was never taught any of this about the power of nutrition and lifestyle. And so I really changed my life in such a deep way that I decided to get certified in functional medicine. And what ended up happening was that I ended up quitting my job, my full-time job in academia, to open up my own practice. Now, I still maintain a position at the university, and I still teach, but I felt like I needed to get this information out there to the world, and I wouldn't be able to do that in an academic setting, having only 10 or 15 minutes with each patient. I needed to spend more time with each patient. So it really has changed the trajectory of not only my career, but my life, because I'm so much better now. And I try to now share this information with my patients to help them as well.
So, so what happened, Dr. Rani, to your headaches?
They got much better. Now, there's no cure for migraine, so it's always kind of there. There's always the potential for having a migraine attack. But instead of having a headache 30 days out of the month, now I'll have a headache maybe 1 or 2 days out of the month. And that is such a huge, plus. I can't even describe like how incredible it is not to wake up with a headache every single day. So I'm a true believer in the power of nutrition and lifestyle, and some supplements too when appropriate.
So, Dr. Tollefson, you had mentioned PMS, and it seems that everything, that is natural has become medicalized. And, if you have a problem with PMS, they give you Advil or whatever to help with that. What natural remedies do you find work to reduce PMS?
Yeah, so great question. So like with so many of the different women's health conditions, and so many of our health conditions in general, especially those that are partially linked with pain, there's a connection often with inflammation. And so I am not anti-conventional medicine at all, but starting with some of those food basics, so trying to decrease inflammation to have a healthy gut microbiome. So getting enough fiber. I'm a huge fan of fiber. Fiber is fabulous for females. It's good for everyone, but the 3 F's, fiber is fabulous for females. So trying to get my patients and others women to eat at least 25 grams or so of fiber a day. The American Institute for Cancer Research recommends about 30 grams of fiber a day, so even higher than that. But really an anti-inflammatory diet. So one that limits ultra processed foods, one that, and avoiding soda, focusing on fruits and vegetables and whole grains and nuts and beans and seeds, all of those different things. So yeah, so for PMS, but really the foundation of women's healthcare, foundation of all healthcare, I think we start with a nutrient-rich, anti-inflammatory, plant-forward diet.
Great, thank you. And Dr. Rani, when people think about the eye, they don't necessarily think of nutrition. Maybe carrots. I think they had some, back in the day, they used to say carrots were so good for your eyes. How does plant nutrition affect eye health, and what types of issues are you able to address with lifestyle changes in nutrition as opposed to traditional medicine?
Yeah, so plants have lots of nutrients. They have vitamins, they have minerals, they have antioxidants, they have bioflavonoids, and all of these compounds can benefit our eyes. Our eyes are actually quite complex, even though they're relatively small, about the size of a golf ball. Within the eye, there are over 40 different structures within the eye, and also there are over 200 different cell types at last count. There was a study published just in December of 2023 that found at least 200 different cell types in the eye. So we need a variety of nutrients to support all of those different structures in the eye and the cell types. And so plants provide us with many of those nutrients. I would say almost all of those nutrients. And so when it comes to eye disease, for example, the most common types of conditions that can lead to blindness as people get older include cataracts, diabetic retinopathy, glaucoma, and macular degeneration. And all 4 of these conditions can be prevented by having adequate nutrition in one's diet. There are actually studies to show that if you have a plant-forward diet, a plant-rich diet, then your risk of developing macular degeneration is anywhere from 43 to 47% less than someone who has a diet rich in processed foods and high in red meat, et cetera. So there is research that has been done with regards to some of these conditions, but not all of these conditions. So this is still an emerging field, and I hope to be helping to promote the field and raise awareness and, just educate people about what they can do using natural means, using their diet primarily, to help prevent vision loss in the future.
And what if you could recommend just a few foods that people could add in, or supplements to add in for eye health, what would you recommend?
So first, we should talk about the nutrients that are important for eye health. And I would say if I had to choose like the 2 top nutrients, I would say lutein and zeaxanthin. These are carotenoids. They're called macular carotenoids. They're cousins to vitamin A and beta carotene and lycopene. So these macular carotenoids are powerful antioxidants, and the foods that best provide them tend to be the leafy greens. So foods like spinach, kale, arugula, any type of leafy green, whether it's mustard greens, dandelion greens, Swiss chard. These leafy greens are very, very rich in the macular carotenoids. But also, as I said, there's a lot of nutrients our eyes need and many foods that can provide those. And so if you were to ask me, okay, what's another nutrient class that's important? I would also say the omegas are very important, in particular omega-3s, DHA, EPA for eye health. By the way, a fun fact, the highest concentration of DHA in the body is actually in the retina, in the retinal photoreceptors, higher than even in the brain. So it is important to provide our bodies with those omegas. And there are many different foods that can provide those omegas, ranging from seeds and nuts to certain types of fish as well.
So you mentioned DHA and EPA, and there's talk in this, like in the whole food plant-based world about whether or not we convert uh, DHA and EPA from our diet properly. And some doctors like Joel Furman talk about needing supplementation. What are your thoughts? I mean, do you find that to be true in your practice when you suggest that to people, or do you find that they can get the necessary nutrients through their diet?
Yeah, so I think that point is very important that not all precursors of the omega-3s get converted to DHA and EPA. So, for example, ALA, which is the precursor omega-3 to both of those other omegas, is found in seeds, like, for example, chia seeds, hemp seeds, flax seeds, but not all of it will get converted. So in my opinion, yes, if one is not eating animal products, then probably should be supplementing. I myself happen to be vegetarian, so I definitely take a supplement, an algal supplement to get my omegas in. So I'm a believer in that.
Okay, thank you. And do you have any thoughts on that, Dr. Tollefson?
Yeah, no, I agree with what Dr. Banik shared as well. I take my algae supplement as well. I'm a whole food plant-based. So yeah, and omega-3s are great for so many different reasons.
Okay. And Dr. Tollefson, you're a breast cancer survivor, as you alluded to earlier when you were talking about your history. What can be done to decrease the risk of breast cancer?
So yeah, this is really really exciting. There's so much that can be done to decrease the risk of breast cancer. I always let people know though that the risk is never zero. So I'm still a fan of screening. I had a normal mammogram at 41, and a year and 1 week later on a routine screening mammogram, I had a 2 centimeter mass that was invading my chest wall that I couldn't feel. I didn't have any symptoms. I had breastfed all three of my kids, didn't drink alcohol. So I thought I was doing all the right things, did obviously self breast exams. These hands were trained to find cancers in other people. And it was the most shocking call of my life. And so my breast cancer, I had that shocking call. I went in the next day, and and for the biopsy, and I sat in that room, and people kept walking by saying, like, why are you here? Oh, I'm so sorry. And I felt myself shrink, like, smaller and smaller. And I thought, if I'm ever going to make it through this, I'm going to need to use all that I have as far as lifestyle medicine with healthy eating. So I actually bought one of the little containers to grow my own broccoli sprouts while I was there. And I bought some pink tennis shoes, and I was like, I'm going to do what I can to embrace it. But as I was learning more and more about breast cancer, I was learning that so many of the same things that Dr. Banik just mentioned for eye health, for brain health, are the same things that are going to decrease the risk of breast cancer as well, and to be helpful for most breast cancer survivors too. So when it comes to the literature around risk reduction, I really like following the World Cancer Research Fund and the American Institute for Cancer Research, AICR. I'm not an oncologist, but I really, as an OB-GYN, as a breast cancer survivor, I really appreciate all that they do to go through the literature. So their recommendation to eat a diet rich in whole grains, vegetables, fruits, and beans, to limit consumption of fast foods and other processed foods that are high in fat, starches, and sugars, to limit consumption of red, and try to avoid processed meat, limit consumption of sugar sweetened drinks, limit alcohol consumption, or I would say avoid it. Um, you know, they recommend not using supplements for cancer prevention, for mothers to breastfeed if you can, and to be physically active and maintain a healthy weight. And so those are their core recommendations. As a breast cancer survivor too, I love looking at the literature around soy. There still is the misconception out there that women who are maybe at an increased risk for breast cancer, or maybe who want to just do everything they can to minimize their risk of breast cancer, that they avoid soy. And really, that is not the case. The phytoestrogens, the plant estrogens in soy are really good for overall health and well-being. In fact, we know that it's safe for women who are breast cancer survivors, such as myself, to eat, 1 to 2 servings a day of whole or minimally processed soy food. So I'm not doing the isolates and the supplements and all of that, but the edamame, the tofu, the tempeh, the soy milk. And those are great as well for menopause. So I, at 42, diagnosed with breast cancer, a bilateral mastectomy. I had 16 rounds of chemotherapy. I had my ovaries removed because of the type of cancer it was. And after doing that, I went through premature menopause. And so I was trying to go through figuring out like what are chemotherapy symptoms, what are menopause symptoms. And so getting hit by menopause, really started to dive into the literature around menopause to see what could be done as far as lifestyle too. And so many of the same recommendations that we hear for brain health and for breast cancer risk reduction are also really good for women during the menopausal transition and beyond. So that's an area that I've had fun really, really exploring. And I think that we don't do enough talking about the menopausal transition and menopause. And I get excited when I get a chance to share information about that.
Do you want to talk more about the transition to menopause and how, how a plant-based lifestyle contributes to an easier, I mean, this is what I hear. Obviously, that's not in my trajectory, but can you talk more about that?
So yes. So what we eat has a dramatic impact on the menopause transition. We know that, so first of all, there's some great research done by Neil Barnard with the Physicians Committee for Responsible Medicine on soy. And what they found is that they had a dietary intervention for vasomotor symptoms, which are hot flashes and night sweats of menopause. And it was a randomized controlled trial. So part of the group was randomized to a low-fat, plant-based meal or diet with a half cup of cooked soybeans a day. And what they found is that those who were randomized to the cooked soybeans, so the group that was the high soy intake group, that they had an 88% reduction in their hot flashes and night sweats. And so we saw some, there's, that placebo effect, we saw some in the other group as well, but we saw a significant reduction. And so not everybody who eats soy during menopause decreases hot flashes and night sweats. There's some differences in the microbiome we think that might be contributing to that. But a lot of women have an easier time with that transition if they're eating healthy foods. We know that women who have a higher intake of poultry and dairy typically have worse menopausal symptoms, and that high fat and high sugar, added sugar diets are associated with the increase in hot flashes and night sweats. On the other hand, women who eat more fruits and vegetables typically have fewer menopause symptoms, and women who eat a vegan diet, whole food plant-based diet, typically have fewer hot flashes and night sweats compared to people who are omnivores. So it doesn't necessarily help you to avoid all of the symptoms, but it sure can make the transition easier. And then we also have some great research with like the Nurses' Health Studies 1 and 2 that looked at changes in plant-based dietary quality. And they found that those women who started eating more healthy plants, so more fruits and vegetables and whole grains and nuts and beans and seeds, those women typically had improvements in their physical functioning, fewer physical role limitations, less bodily pain, better general health. They also found that women who started to increase more unhealthy foods, even if they were plant-based, but people who just started to eat more ultra-processed food or junk food, because as we know, you can be a really unhealthy vegan. You can eat, all of your vegan junk food. And so those people who started to eat more of that food had worsening of physical functioning, more bodily pain, and more general health. They found the same thing. Those women who started to, during that menopause transition, those women who started to eat more high quality plant foods had improvements in their mental health and their vitality as well. So yes, huge fan of plants for many reasons, and especially during the menopause transition and for decades to come.
So thank you, Dr. Rani. A couple questions for you. One, as people get older, their eyesight tends to go a little bit, and people who eat plant-based diets tend to think that they're somehow immune to various things. You mentioned a bunch of symptoms, but what about deteriorating eyesight? Is that just a normal occurrence of age? Is that an issue? Is that a sign of an issue? Can eating a whole food plant-based diet minimize the loss of vision that people often see as they age?
So first of all, I just want to say that not everyone experiences age-related vision loss. There are some things that happen as we get older. For example, most people will develop presbyopia. Presbyopia is difficulty reading up close, where our lens can't accommodate as well as it used to. The lens is simply not as flexible. So both people who are on a plant-based diet as well as those who are not will develop presbyopia. So that's irrespective of dietary choices. There are other things, though, for example, cataracts, I mentioned earlier, macular degeneration. in which the diet can make a difference. So there are studies, in limited studies, there haven't been that many large scale population studies in the ophthalmology space with respect to diet, but there are some studies that show that populations that have higher intakes of fruits and vegetables, at least 3 to 4 servings a day of fruits and vegetables, have a lower risk of developing cataract. Now, that being said, if one lives long enough, everyone will develop a cataract. But the question is, when does it become symptomatic? And it's possible that by including more plants in one's diet, that can delay the development of a symptomatic cataract. And in terms of macular degeneration, the same. There are some larger studies in macular degeneration. For example, there's the largest study that was done, looked at over 100,000 individuals and followed them over 26 years. And that study definitely showed that individuals who are on a plant-rich diet, plant-forward diet, had about 43% reduction in advanced macular degeneration and progression.
And how about going out in the sun for eye health? Is the sun something that we need to wear sunglasses to protect ourselves from? Is the sun something that we need? There's talk about it being a good idea to go out for early morning sun to reset your circadian rhythm, to have healthy sleep cycles. But then you're going out in the sun and you're getting sunlight into your eyes. Is that damaging? Is that good for us?
Yeah, so the sun emits various different wavelengths of light. It emits UV light, which is typically the rays that get into our eyes are UVA and UVB rays. And these rays can be associated with a myriad of ocular problems. For example, growths on the surface of the eye that are either benign or malignant. Excessive UV exposure can lead to burns on the cornea, burns in the retina, and also increase the risk of cataracts and macular degeneration. So it is my belief that we should be protecting our eyes from the sun. And I typically recommend that one should wear UV blocking sunglasses between the hours of 10 a.m. to 2 p.m. when the sun is highest in the sky, at its zenith in the sky. Now, outside of that, whether early morning sun is beneficial. Well, yes, there are benefits. So that primarily the benefits come from blue light that also gets emitted by the sun. Now, blue light is, if you think about the rainbow of colors, blue light is on the shorter end of the wavelength of the rainbow. And these rays are unique because these wavelengths are picked up by certain cells in the retina that could then communicate to the brain, to the pineal gland that helps us set our circadian rhythm. So yes, early morning blue light exposure is beneficial to set our circadian rhythm. And also late night blue light exposure can potentially offset our circadian rhythm, making it harder to fall asleep or stay asleep. Now, with respect to going out early in the early morning and getting that sunlight, what I typically recommend is don't look directly at the sun or stare directly at the sun. Now, we probably all have heard this, with the recent eclipse, don't look at the sun directly, wear your eclipse glasses. Well, the same is true even without an eclipse. It's not a good idea to stare directly at the sun because those rays are so powerful. So I would say if you want to go and get that blue light exposure in the morning, do it with your eyelids closed so you can face the sun with your eyelids closed, and those rays will still get in and still stimulate your circadian rhythm. So that's my typical recommendation.
So the eyelids actually do protect you from the rays, or do they block the rays or they minimize the rays? Is that what
A lot of the rays, the potentially harmful short wavelength rays can get absorbed by the lids. Now, of course, that may put you at risk for eyelid cancers, but if you do it super early morning, you're not doing it between the hours of 10 a.m. to 2 p.m., it should be okay. And I don't recommend doing it for 20 minutes, an hour, 2 hours. I know some people do that as part of their morning routine, spending quite a bit of time looking at the sun. So if you do early morning sun gazing, I would recommend limiting it to anywhere from 3 to 4 minutes at the most, again, with the eyelids closed.
Okay, eyelids closed. All right. And you mentioned blue light. How does environmental exposure, such as screen time and blue light, affect eye health? And what preventative measures do you recommend?
Yeah, so the good news is there is no real long-term consequence of too much blue light exposure. There were some articles that were published about 5, 6 years ago that created a lot of fear in the media, that was propagated by the media saying, oh, blue light exposure will kill your retina cells and cause you to go blind. Well, that's not true. And if that were really true, we would have an epidemic of vision loss right now. But what is true is that the blue light that comes from our screens, that comes from all of our devices, our television sets. Blue light also comes from the energy saving bulbs that we tend to use, CFL bulbs, LED bulbs. They all emit blue light. So that artificial blue light can cause short-term issues and may cause symptoms like eye strain, light sensitivity, headaches, eye fatigue, blurry vision. So these symptoms we typically call digital eye strain. It's kind of an umbrella term that we use for all of these symptoms associated with blue light. Luckily, they're short-term issues, not long-term issues. So again, we are in a digital age, so it's inevitable that we're going to be on screens. We can't avoid it in this day and age. But the good thing is you have to realize, okay, when should I modulate my screen time, particularly as the evening goes on, after the sun sets? Our eyes are not supposed to be exposed to all of this artificial blue light, and it may interfere with our sleep patterns. So you may want to get bulbs that are smart bulbs, so they change their color tone after the sun sets. You may want to put an app on your device that will automatically reduce the blue light coming from your screen after the sun has set in your geographic location and allow for more of a reddish kind of a warm tone to your screen that is probably better for sleep. So you can do things like that. There are ways to modulate that.
And when should we avoid, at what point in the evening should we avoid, a lot of light exposure so that we don't mess up our sleep?
Typically 2 hours before bedtime. And again, I know it's very challenging for many of us, myself included. I tend to do some of my best work in the evening and I'm on my screens, but we do what we have to do. But if you take the precautions, like I said, maybe install the screen filter app. There's one that I really like. It's called Iris, iristech.co, and you can download it. And there's also the question of whether people should be wearing blue light glasses or not. And I do want to address that briefly because I know a lot of companies market these blue blocking glasses. The truth is, not all blue blockers are made the same. Some of them look very light in color, like for example, they're clear or they have a very light yellowish tint. Now, those blue blockers really don't do very much. And they only block about anywhere from 10 to 30% of the blue light. And the way you know is you can put the glasses on, look at your screen, look at something that's blue on your screen. If you can still see the color blue, it's not blocking all of the blue light. Versus if you get a blue blocker that is a deeper tint, for example, a deep red, deep orange, amber, if you put those blue blockers on and you look at your screen, you will not be able to see any blue whatsoever. So my recommendation is if you want to get blue blocking glasses, especially for nighttime screen use, get the really deep tint because then at least it's blocking about 98 to 99% of the blue light at that time.
Great. Thank you. Dr. Tollefson, Michael Greger has done some videos on ginger for helping PMS symptoms, particularly cramping. What are your thoughts on ginger? Do you know anything about that?
Ginger and PMS. That's a good question. I'm not thinking of any studies, but I'm sure I love Dr. Greger. And I'm sure that if he highlighted some studies, I'm sure that they are there. There's some interesting research on PMS. There was a study done where they looked at nurses and they had them for 2 months. They just had them, or they randomized them into half were in the control diet and half were in a whole grain. And so they just wanted them to replace the grains that they were doing with whole grains. And so the intervention group that just went from their ultra processed to their whole grains had a significant decrease in general mood, physical, and behavioral PMS symptoms. There's also some research, again, on the nurses' health study, case control study, where they saw that after 10 years, that the women who had the highest quintile of non-heme dietary iron, so the highest intake of plant-based iron, had a relative risk of PMS of 0.64. So there's some interesting research there. And then we know, like, just like anything that has to do with pain, we know that PMS, like pain promoting foods, are often those that are in that are lower quality. So lots of added fat, sugar, salt are associated with an increase in symptoms. So ginger is anti-inflammatory. I know it's good for many different things. I don't know the ginger literature, but I look forward to listening to Dr. Greger's video and learning more.
Right, great. Yes, it's some interesting stuff. So we were talking a little bit about breast cancer earlier, and we talked about reducing the risk of breast cancer. What about reoccurrence of breast cancer? What are measures that women can do to reduce the risk of a recurrence?
Yeah. So the American Institute for Cancer Research and the World Cancer Research Fund recommend after a cancer diagnosis to follow those same recommendations that I shared earlier. So a high fiber diet, eating the rainbow, lots of different phytonutrients. So high in fiber. As far as decreasing the risk of recurrence, a healthy diet is part of it. Also, it's important to maintain a healthy weight, which can be an extra challenge, especially for women who have gone through chemotherapy. But maintaining a healthy weight and then being physically active. The research around physical activity for breast cancer survivors is really powerful too. And of course, we want to do things that decrease the risk of recurrence. But what they found is that eating a healthy diet, eating a real nourishing diet, whole food, plant predominant, plant forward diet, that it also improves quality of life and helps with many of the symptoms that women who are breast cancer survivors deal with, such as decreased energy, such as anxiety, fatigue. So many of those different symptoms, aches and pains. Many women are on like an aromatase inhibitor, endocrine therapy afterwards, which can lead to some additional aches and pains, or just going through menopause. So in addition to a healthy diet, like one recommended by the American Institute for Cancer Research, being good for decreasing the risk of recurrence, and getting that physical activity in too. Also, they help with quality of life, which I think is so important for cancer survivors.
So some doctors are critical about mammograms, such as Dr. Jen Simmons, and specifically for discomfort, risks, and inaccuracies leading to unnecessary procedures and radiation exposure. And she advocates for QT imaging, which is a revolutionary non-invasive breast cancer screening technology that supposedly offers a safe, more accurate, and comfortable alternative without compression, especially effective for dense breasts. What do you recommend instead of mammograms, or do you think mammograms are okay?
So I recommend mammograms. I follow as an obstetrician gynecologist. I'm part of the American College of OB-GYNs. And so I follow just the general recommendations. I'm not aware of that physician or her recommendations, and I'm also not an oncologist. But I do. I'm here because a mammogram caught my breast cancer, and so obviously, um, you know, but even the data show us that mammograms have benefit. There is debate over how often you get screening. I recommend that women typically have mammograms every year, just the general recommendation by American College of OB-GYNs starting around age 40. But really, I think that it's important to have a discussion with one's physician to talk about risks and benefits. If somebody has a higher risk, maybe starting earlier. If somebody has extra dense breasts, if there are certain issues, that they discuss that with their doctor and then look into what's the best screening. So I don't have any, I guess, more alternative recommendations. I do know that when you screen more often, there is that risk that you find something abnormal, and the fear associated with waiting for that result. I mean, that's very rare, or that's very real. So that's where you get different organizations sometimes saying, the frequency of a mammogram should be different. I believe women should have access to mammograms every year if they desire them, and then of course talk with your physician about risks and benefits.
And as you go and check nutritionfacts.org, Michael Greger's website, he has a whole series on mammograms
Yeah.
and breast cancer that you can check out too.
Yeah.
So, Dr. Rani, macular degeneration, can you provide insights into, first of all, explain what macular degeneration is, who tends to get macular degeneration, what in their diet may be contributing to an increased likelihood of macular degeneration, and what people can do to avoid or repair, if possible, macular degeneration.
Yeah, so macular degeneration is one of the leading causes of vision loss, not only in the United States, but around the world. And it tends to affect older individuals. So individuals who are late 60s, 70s, 80s, 90s, the numbers keeps going up as the age increases. What happens is, and I can actually pull out my handy dandy eye model here to show you. So this is the eyeball, and normally we just kind of see the front of the eye, which is this part, but there's a lot going on inside the eye. So I'm going to open it up to give you a sneak peek inside. Now, show you here. I'll remove some of these structures. So light comes in through the pupil here and hits the back of the eye. The back of the eye here is the retina. And the retina is normally clear, it's transparent, but it looks orange here because there's a lot of blood supply to it. And this yellow spot right here represents the macula. And the reason why it's yellow is because of those macular carotenoids, the xanthophyll carotenoids that are yellow in color. So again, lutein, zeaxanthin, mesozeaxanthin, they get deposited right here. And what happens in macular degeneration is that there's too much oxidative stress in the back of the eye, right here in the macula, and it leads to waste deposits that don't get cleared by the cells underneath the retina. Those waste deposits accumulate, they grow, and then they cause inflammation. And then after that, so it's a sequence of events. After the inflammation, then there's a signal for new blood vessels to grow. And these blood vessels, they grow, and then they tend to break and they bleed. And when they bleed, that's usually when people have significant vision loss from macular degeneration. So again, it's a sequence of events. It doesn't happen in a short period of time. Actually, it probably takes years or even decades for this process to happen, which is a good thing because it means that there is time for us to intervene. But once it becomes an advanced stage of macular degeneration where I should also explain that there are two types of macular degeneration. There's dry and there's wet. So the early stages tend to be the dry stages, but once the bleeding begins or once there's fluid, that is the wet stage. And the goal is to try to prevent someone from going to a dry stage into an advanced wet stage of the disease. And we know from clinical studies that, observational studies, that the more lutein and zeaxanthin people have in their diets, the people in the highest quintile intake of these two nutrients, the lower their risk for wet macular degeneration, the lower their risk for vision loss. So there's a direct correlation between how much we're getting from diet, perhaps diet plus supplements, and the risk for vision loss from macular degeneration. And unfortunately, these studies, even though they've been published, they've been out for 10, 15 years now, most ophthalmologists, unfortunately, are not so well versed in the studies. Most ophthalmologists, a lot of my colleagues, and myself included, up until I became aware of the importance of nutrition, really would just tell patients, "We'll just wait and see. Everything's okay now. We'll just monitor you once a year." And we never really tend to give our patients that much education in the nutritional aspect or the lifestyle aspect. And I think that really needs to change because ophthalmology typically has been very reactive in terms of a field. We wait until something happens and then we treat it with either medication or surgery or laser or injections. But really, we need to switch that narrative and be more proactive rather than reactive when it comes to eye disease. And macular degeneration is a prime example. When they develop wet macular degeneration, the standard treatment includes injections into the back of the eye. So these are monthly injections that patients have to get to prevent the bleeding in the back of the eye, prevent the fluid from accumulating. And so it's not the easiest treatment to endure, but it does help to save people's vision. But why are we waiting until that happens? There's so much we can do prior to that. And there's also literature out there on lifestyle factors as well with respect to macular degeneration. One of the biggest risks is actually smoking. There was one study that looked at identical twins in which one twin smoked and the other twin did not smoke. And they were followed over a course of many years. And the twin who smoked had a double, 2 times the risk of developing advanced macular degeneration compared with the twin who did not smoke. Other lifestyle factors include maintaining a healthy body weight, getting regular exercise at least 3 times a week. And there's some debatable literature out there regarding other things like sleep and stress. But hopefully over the next, a few decades, we'll have more insights into those lifestyle factors as well.
How about diabetes? Is that a factor for macular degeneration?
So it's not an independent risk factor, but certainly diabetes itself is a risk for diabetic retinopathy, which is a slightly different retinal disease. It can cause blood vessels to form that are not normal and also cause bleeding in the back of the eye and vision loss. So the ultimate pathway is similar, but they are two independent types of conditions.
And once macular degeneration has begun, can it be reversed through lifestyle changes if it's caught early enough, or you're kind of stuck with it?
So in my experience, once people develop the waste deposits in the back of the eyes, I have not seen them reverse. The goal is to prevent them from increasing in number and size. And these deposits, they're called drusen, drusen. And so again, in my patients, when I counsel them, the goal I tell them is to maintain your central vision, but also to maintain stability of your drusen so that those drusen don't keep increasing in size and number, because as they do, there's more of a risk of the disease that it may progress into wet macular degeneration.
So, Dr. Tollefson, what issues most affect women and their health that can be impacted? Well, and specific, obviously there are certain things that affect everybody, but you're an OBGYN. So what female issues, I guess we'll call them, are most susceptible to being impacted in a good way by a whole food plant-based diet?
Oh, so I would say so many different things. I think one of the areas that I've been working with people recently, and there's been a lot of interest around, is the menopause transition and body composition. We see so many women, it's starting about 8 or so years before the final menstrual period, where we start to see an increase in fat mass, especially abdominally, and a decrease in lean muscle mass. And so I think that it's sometimes easy just to say like, oh, well, as long as you're eating, as long as you're not, we don't need to get tons and tons of meat or tons and tons of protein. And I agree, we don't need tons of protein, but we need to make sure, at least as women going through the menopause transition, that we're getting adequate protein. And the US RDA for protein for all adults is 0.8 grams per kilogram per day. I love Brenda Davis's plant-powered protein. She's an RD who's absolutely phenomenal. And she has a book called Plant-Powered Protein. And many people think the 0.8 might be a little bit low for women who are trying to increase their lean muscle mass. And if people are eating fiber-rich plant protein only, they may need to bump that up at about 10%. So it's not a lot, but I think that women, when they go through that menopause transition, just need to be mindful of, are they getting enough protein? Having protein-rich meals or snacks every 3 to 4 hours. So really focusing on those beans and those seeds and those nuts and tofu and tempeh and soy milk, because it becomes harder to build that lean muscle. And we also know it's synergistic with resistance training too. So that's just an area that I've really been focusing on. I realized that there were so many women who just assumed that they were getting, since we don't need, there's kind of that myth that we need tons of protein, and we as whole food plant-based advocates know we don't need tons of protein. But I think that we also have to be careful that we're not just saying like, oh, well, we're sure we've gotten enough. And I think it's good for women to check in and say, where are they at, to make sure that they are at that like 0.8 or maybe a little above that, in order to increase their lean muscle mass when we see that decrease in lean muscle mass that happens with that menopause transition, and the slowing of metabolism, all of those different things. And so that whole food plant-based way of eating that really decreases inflammation, that helps to decrease inflammation throughout the body, that helps to help women weather that change in body composition that we see so often, I think is important. And then also when we age match men and women who are thriving late in, or who are living late into later life, we see more functional disability in women. And so that's another thing, that in addition to a whole food plant-based, making sure that there's adequate protein way of eating, we also need to make sure that women are doing their resistance training and are getting adequate physical activity. We know that those, the numbers are pretty low for aerobic activity, and then even lower as we get to like 65. I think it's about 10% of women who are meeting the physical activity guidelines by age. And when they used accelerometers, it was like, I think 2% of women who were in their 60s who were actually meeting those guidelines. So really important for women to be able to do their aerobic activity and to get in at least 2 days a week of resistance training. And you don't have to go to a gym. You don't have huge muscles, but you need to be using the resistance bands or body weight, or doing something that puts some stress on those muscles so that you can maintain your lean muscle mass, so that we can maintain our mobility, so that we don't fall, so that we can maintain our balance, so that we can thrive, so that we can do what we want to late into older age. And we look at all the research from the blue zones, those areas where people live the longer, healthier lives, those pockets of centenarians and octogenarians, and we see that they're eating a plant-forward diet, and they're getting in their beans and nuts too.
So that's actually the first I've heard that women suffer more disability as they age. What accounts for that difference between men and women?
That's a good question. I'm not sure. I'm not sure as to what accounts for all of it, but I do know that women, they have, when we compare them to age-matched men, that women typically have an impaired ability to do the activities of daily living. We see more difficulties with self-care, lower quality of life. They have an increased risk of falling, more hospitalizations, more nursing home admissions. And so it's really important. And with menopause, we see that menopause typically comes along with an increased body fat, increased muscle atrophy, decreased muscle strength, decreased bone strength. Those are just those typical things that happen with menopause. And I tell women, they are typical, but that doesn't mean that they're inevitable, because with physical activity, we can decrease body fat, we can increase muscle mass, increase muscle strength, increase bone strength. And so it probably has something to do with muscle mass. It probably has, muscle mass, bone strength, all those different things. So I'm not sure of the studies that show the specific reason as to why, but I do know it's extra important for women, especially during the menopause transition and beyond, to be physically active and to be eating healthy, nourishing foods that support bone health, that support muscle health as well.
Okay, thank you. Dr. Rani, can you share a case study where dietary changes significantly improved a patient's vision or eye health?
Yeah, absolutely. So one of my patients, I'll call him Bob, he was in his mid-60s, and he was very worried because both of his parents had wet age-related macular degeneration. So he knew that he was at risk. He had some genetic testing done, which also confirmed that he was at high risk for developing macular degeneration. And what had happened was he'd seen other eye doctors before, and he was diagnosed with an early stage of macular degeneration. And he was really concerned that he would progress and ultimately go blind. And so he came to me for additional counseling about nutrition, lifestyle. So I put him on what I call the macular degeneration diet. Now, this is something that I know I put together based off of my research into ocular nutrition. And it's really rich in lutein and zeaxanthin primarily, but many of the other nutrients that we need for eye health. And it's similar to the Mediterranean diet, but much more, again, plant forward than the Mediterranean diet. So he began this diet, and prior to that, he was basically living off of a lot of junk food. And we know that people who do live off of a lot of processed foods and refined sugars, omega-6 an omega-6 rich diet, they are at higher risk for macular degeneration progression. So he never realized that. So once we shifted his diet, he lost weight. He actually lost about 25 pounds. And now I've been following him for about 6-7 years, and he has been absolutely stable. He still has 20/20 vision centrally. He still has good night vision. He has not progressed. He's still in the early stage of macular degeneration. So he's really, very, very happy that he's remained at that stable stage. So it's not that it completely reversed, but the main thing is that he's been able to maintain his vision. And hopefully in the future, in the next 10, 20, 30 years, he will avoid the fate that both of his parents unfortunately had.
So I was reading a little bit about you, and some of the things that you tend to treat that are quite common are things like blepharitis. What would be what is blepharitis? What's the cause of blepharitis, and how do you, as an integrative doctor, treat blepharitis?
So blepharitis is inflammation of the eyelids, and there's actually two types. There's anterior blepharitis and posterior blepharitis. So the eyelid has multiple layers to it. Anterior means on the surface, there's inflammation, and usually that is associated with almost like dandruff, like flakes on the surface of the lashes, and it causes irritation. It can lead to dry eye, but usually the cause of anterior blepharitis is actually eyelid mites. There are mites that can kind of go and get into the follicles of the eyelashes and cause this inflammation. So it's called Demodex mites. And so there are treatments for that. There are ways to decrease mite infestation on the eyelids. And one of the best strategies I love is eyelid hygiene. And so I use essential oils for this. So this is something that not a lot of my colleagues, again, in traditional ophthalmology have really used in the past, but now I think more are realizing the benefits of using something like essential oils. And so tea tree oil, melaleuca oil, has been shown to decrease mite infestation as well as frequent eyelid hygiene. The second type of blepharitis is posterior blepharitis, in which the glands of the eyelids, we have these tiny little glands just behind our eyelashes, and they secrete oils for our tear film. And so if the glands are not healthy, the tear film becomes unstable because not enough healthy oils are secreted, and the tears evaporate, leading to dry eyes. So 90% of people who have dry eye actually have this posterior blepharitis. And so the way we treat that, or I treat that using an integrative approach, is really to focus on a patient's diet, to try to avoid pro-inflammatory foods, try to avoid diets that have a really high omega-6 to 3 ratio, try to balance that out, increasing one's intake of omega-3s while maintaining the omega-6s or cutting out the unhealthy omega-6s from processed foods. And so that's really made a big improvement in a lot of my patients, as well as putting them on an omega supplement. And in terms of other things that people can do for blepharitis, simple lifestyle things like doing hot compresses and doing them in the proper way, and using eyelid washes, things like that can really make a big difference for the surface of the eye.
Right. And you mentioned omega-3s versus omega-6s. What does avoiding omega-6s look like in someone's diet? Like what should they avoid eating?
So the pro-inflammatory omega-6s, I would say, I tell my patients, try to avoid fried foods, ultra-processed foods that probably have a lot of chemicals in them as well, and increase their intake of nuts and seeds, as we've heard many times today during our session. So those are the foods that I try to steer them away from, and the ones that I try to steer them towards. And of course, if one eats fish, there are multiple studies to show that increased fish intake is associated with decreased dry eye and meibomian gland dysfunction. So if one does eat fish, then fish 2 to 3 times per week is typically what's recommended.
Great, thank you. Dr. Tollefson, and this may be outside of your exact expertise, but regarding women's health, obviously this is for both men and women, but decreasing the risk of Alzheimer's, dementia, and improving brain and mental health is a priority for many women as they age. What do you recommend that they do to avoid that?
Yeah, so brain health, that's an area that's so important. So I went through early menopause, and going through early menopause and not using hormone replacement therapy, as I would not be a candidate for because of having a hormone receptor positive cancer, that puts me in an increased risk for dementia. Also, I have one copy of the ApoE4 gene, which increases my risk of dementia. So I do everything that I can to optimize my brain health. And I love talking about brain health. as far as nutrition, what we've already been discussing is really important. So all of the nutrition, all of those recommendations, eating a lot of your leafy greens, right? Your blueberries, your nuts, all of those phytonutrient rich foods. And then exercise. The brain loves exercise. So we know that exercise decreases inflammation, lowers the risk of dementia. We may even see some cognitive improvements for women with mild cognitive impairment. And so during menopause, we often see an increase in obesity. We often see an increase in insulin resistance, leptin resistance, pro-inflammatory cytokines, and a decrease in our anti-inflammatory markers. All of those things can decrease cognitive function. On the other hand, we know that when women are physically active, when they're getting in their aerobic activity, that it increases insulin sensitivity, it increases anti-inflammatory markers and decreases those pro-inflammatory cytokines. We know that brain-derived neurotrophic factor, which John Rady calls like miracle grow for the brain, BDNF, is released. And so we have an increase in neural volume, activity, brain connectivity, genesis of new neurons, neuroplasticity, all of those good things. So movement is so, so important. In fact, there are studies done looking at midlife cardiovascular fitness and then looking at high compared to medium fitness. And then we can see like an 88% difference in dementia risk when they did a 44-year follow-up. Sleep is huge as well. And so the importance of getting adequate sleep, at least 7 hours a night, and all of the different sleep hygiene, cognitive behavioral therapy for insomnia, sleep hygiene tips are so important, such as those that Dr. Banik mentioned. Dr. Beth Brady's a colleague of mine mentions keeping your bedroom like a cave, keeping it cool, a little cool, keeping it really dark, really quiet, trying to wake up around the same time every day and going to bed around the same time every day. For women, often getting up at night to use the restroom becomes more and more common. So trying to use the restroom before bed to limit those trips. Of course, to avoid that, the screens and the blue wavelength light, like Dr. Banik mentioned, all of those become so important. And then also the power of connection. We have Surgeon General Dr. Vivek Murthy, who has that great book called Together, I believe it is, which talks about the power of connection. And so also, we know there's an epidemic of loneliness, especially among older women, 60, 65 plus. We see more and more women who are living alone, who aren't connected. And so it's not about having a million likes on Facebook, but at least having a few friends that you can really reach out to and connect with when things get rough. And so we really need to prioritize our connections and not just see them as something extra or frivolous that we do when we have spare time, but to really see those as something that's important to our brain health as well.
Dr. Tollefson, how does the way that you talk about like mental health and loneliness, and how does the way that we think and feel affect our health? Can our minds make us more likely to get sick or change how quickly we recover from illness? And is there any proof to that?
That's a good question. So I think our thoughts definitely impact behaviors. I was one of the first couple, Dr. Beth Brady and I were two of the first physicians ever trained as wellness coaches. And so, you look at all of the science around behavior change, and our thoughts are very powerful. So what what we think, all of the different hormonal changes, all the chemical messengers, the relationship between our thoughts and stress, and then the inflammatory cascade that we see with that. So I would say our thoughts definitely play a role in healing. If we have more inflammation, we can have more pain, we can have problems with healing. So I would say that there's definitely a connection there, even though that's not my area of expertise. There's definitely a connection. Then also it impacts our healthy lifestyle behaviors, how likely we are, based on our thoughts, how likely we are to choose those healthier foods, to be more physically active, to reach out and to be socially connected, to get enough sleep. If we're really anxious, it's harder to sleep. If we can't get enough sleep, it's harder to be relaxed. Stress and sleep are so incredibly intertwined.
And so, give me 1 second here. So, how do you guys find, both of you, this is, you guys have more of a holistic approach. How do you find that your patients are receptive to your protocols? Dr. Banik, you can go first. Are you muted? You're muted. You can't seem to unmute yourself. How about now?
Yes, that works.
There
Yeah.
you go.
So I think my colleagues view me as kind of a unicorn. They kind of look at me a little bit oddly and say, "Okay, why are you doing this? Don't you want to be in the operating room? Don't you want to be doing cataract surgeries and lasers? And isn't it so rewarding to treat eye disease that way?" And I tell them it is, but also when you think about the health of a person, to allow them to lead a full life to be able to do all of their activities, especially activities in which they rely on their vision for, reading, driving, working, seeing the faces of their loved ones. Like, wouldn't it be better for us to try to promote that type of function rather than to just treat it after it's already happened? And they kind of agree. They look at me like, yeah, yeah, I guess so. But um, I really think that it hasn't quite caught on yet. But what I do think will happen is that as people become more health conscious, they will be asking their providers for this guidance. And so I think providers will have to provide it. And I know a lot of my colleagues sometimes will say, "Oh, I had a patient come in today and ask me, what should I be eating for my eyes? What should I be eating for my glaucoma? Or what can I do for my dry eye? What can I do for my cataract?" And I refer them to you. So I think they're realizing um, that they need to be versed in this as well. But it's a process. It's definitely a process, especially amongst a group of physicians who are mainly surgically based.
And Dr. Tollefson, what's your experience?
Yeah, so I mostly see people now through consulting, and then also I do group sessions with the nonprofit organization called Paving the Path to Wellness, which was created by my dear colleague and friend who I mentioned earlier, Dr. Beth Brady's from Harvard, as well as Dr. Amy Commander, who's a breast oncologist. And so with that program, we do like typically 12 group visits, and we talk about everything from physical activity to nutrition and stress management and sleep and social connection. But we also talk about the power of purpose and attitude, and how do we use variety and investigation and goal settings in order to live our best life. So I enjoy working with women who are trying to optimize their health and well-being, whether they're a breast cancer survivor, whether they're going through that menopause transition, and then a lot of women who are trying to increase their health span and lifespan, who want to live into their 80s, 90s, to learn lessons from the blue zones and to really do what they can to thrive too.
Great, thank you. And we have about 2 minutes left, so I'll give each of you doctors a minute. Dr. Banik, you can go first. Just to anything you want to leave the audience with as far as how they can best take care of their eyes, or whatever thoughts you have to leave the audience with.
Yeah, absolutely. So I always say our vision is so precious. Most people think of it as our most important sense, yet we take it for granted. We just wake up assuming that we'll be able to see well, but when our vision is not good, it can really debilitate us. So we need to be proactive. And the best ways you can do that are through nutrition and lifestyle. So include those macular carotenoids in your diet, include a diversity of plants in your diet. Um, have healthy habits. Get some exercise in on a regular basis. Try to reduce your stress levels. Sleep well. Take a supplement to fill in any gaps in your diet. Those are the recommendations I would have. And also see your eye doctor once a year. Many people don't realize that adults need to have an annual eye checkup. So after the age of 40, an annual eye checkup is really beneficial.
Great. And go ahead, Dr. Tollefson, final thoughts?
Sure. Yeah, so I think the excitement and the joy that comes from self-care. It's not just about living a longer life, but about really thriving too. And I think that's what healthy lifestyle behaviors can really help us to do. Also, your community is welcome to join the Paving the Path to Wellness. It's a nonprofit organization, and I believe we have Dr. Teresa Stone joining us on next Thursday for a plant-based cooking class. It's free to anyone who wants to join. So we have that community as well that advances lifestyle medicine, and anyone who wants to be a part of it's welcome to check us out.
Great. And Dr. Tollefson, for people who want to learn more about you and follow your work or get in touch with you, how could they do so?
Yeah, oh dear, I think my website's drtollefson.net. Isn't that I should
We
yeah.
actually have it up for you.
Thank you so much.
We
Yes,
were ready. You don't have to remember. You can just read it.
yes. Thank you. But the Paving the Path to Wellness, we have a couple books that I co-authored with Dr. Beth Brady's and Dr. Amy Commander. All the proceeds go to the nonprofit organization. I would say instead of, you can check out my own page, but even better than that, check out the Paving the Path to Wellness, that nonprofit organization. We're really trying to spread the lifestyle medicine, evidence-based, practical tips. We're really trying to share it with the world. The world needs more of that. And so that's where I would encourage you. Yeah, you can check out my own page, but check out this. And you can go to that like Pavers Place. And we have those gatherings twice a month. We have a Pavers Place and we have a paving class for connection. We had Tom Brady's chef on recently, who is plant forward and talked about all of his cool things. So we do a lot of cutting edge research, evidence-based guidelines, but really making it practical too. So, and once again, free gatherings at least a couple times every month. And anybody's welcome to join.
Great. And Dr. Banik, how about you?
The best place to connect with me and find out about what I'm up to is my website, www.drranibanik.com. And I have a couple of books that I published. One is called Beyond Carrots, Best Foods for Eye Health A to Z. So if you're interested in learning more about ocular nutrition, you can take a look at that. And I also have something called the Nutrition IQ Test. So it's an online tool. It's free. You can take the test. It takes about 5 minutes. And once you answer the questions, it will give you personalized recommendations on what types of foods to include in your diet. And it couples with the book. So the quiz and the book kind of go hand in hand. I also have a companion cookbook to Beyond Carrots, Dr. Rani's Visionary Kitchen. I do run, in addition to my practice, I do run online courses. So I can help people, guide people in how to take care of their eyes and learn the details about what they need to do for conditions like dry eye or macular degeneration, et cetera. So you can find all that information on my website.
Great. Dr. Banik and Dr. Tollefson, thank you so much for joining us this evening and the information that you shared. If we can unmute the audience so they can share their appreciation.
Thank you very much.
Thank you so much.
Thank you.
Doctors.
Thank you.
Would be any day now.